Good evening, good evening. I am so happy to be here with you all this evening in the month of October, which is Breast Cancer Awareness Month. I am Dr. Monica Riley, and I am the president of the Las Vegas chapter of Women of Global Change. Women of Global Change, we are a network of like-minded servant leaders. And we believe those that serve succeed. And tonight I have a very special guest, Sally Spurgeon, who has developed the Spurgeon method. And we will delve into that a little bit more in a minute. But as she and I were speaking earlier, it is so very important for we as women to actually build into our daily self-care routines and self-care rituals, methods for early detection, breast massage, knowing what our breasts look like, knowing if there is a change visually, feeling and touching our breasts. Don't be afraid to touch your breasts, right? Because they're there every day.
Yeah.
um, so, um, Sally, welcome. You know, I always, your energy really just lights my energy. And I always love when we can come together in a shared space. And I just love listening to you with respect to your knowledge and your expertise in this area. So, welcome, welcome to the Fireside Chat series.
Thank you. Thank you so much. I'm
And
really
what I want to do now is share with our audience a bit about Sally. It's a lovely day here in Las Vegas. All right. I'm going to stop my share so that I can see. It's a little better. Okay. All right. Sally, can you pronounce where the city in England where you are originally from?
yeah, it's called Cheltenham.
Cheltenham. Okay.
That's
So
how
originally from Cheltenham, England, Sally Spurgeon came to the US in 1982 and has called Las Vegas home since 1989. Having worn many hats in her lifetime, Sally is currently the owner of Therapy, a massage and bodywork office which specializes in treatments for women who have undergone surgery for breast cancer. Sally is a board certified massage and bodywork therapist, a medical massage practitioner, and a certified lymphedema therapist. Following her own experience of a breast cancer diagnosis in 2008, Sally became obsessed with learning about breast tissue and breast health. She now educates women about how to take care of their breasts and how to become aware of signs and symptoms of breast cancer. Having studied with breast surgeon Dr. Ann O'Neill and reconstructive surgeon Dr. Kayvon Kibani, Sally created a protocol which has become known as the Spurgeon method. This treatment is beneficial for anyone who has undergone any type of breast surgery, whether for cancer or cosmetic purposes, and also helps those with upper torso restrictions or swelling. Sally's goal is to make this technique available to every person. Just lost my place, forgive me. Sally's goal is to make this technique available to every person who undergoes mastectomy surgery and to bring awareness of the need of a simple daily breast routine to promote healthy breast tissue and alert to any changes. Welcome again, Sally. It's wonderful to have you with us today.
Thank you so much.
And before we begin your presentation, do you have anything that you would like to share with us about your presentation and what's coming up in the next 60 minutes?
So basically what's coming up is some of what I've learned. Just things I think it is a good idea for women to know. It always amazes me how little women know about their breasts when we start talking, like, and how to keep them healthy. So basically all I'm going to do is run through kind of my experience, what I've learned, and what I feel I can share with women to help them promote and maintain healthy breast tissue. And of course, to alert to any changes, you know, and just techniques to use that they can do that.
Absolutely. And I know that you're also going to share with us and introduce us to a new app that is going to be on my phone before we complete this evening.
I hope it'll be on everyone's app at the end of the evening. Yeah.
Yes. And if anyone has any questions or comments, please drop them in the chat, as well as please let us know where you are visiting with us from this evening. So, Sally, let's begin.
All right. Let's hope I can share my screen correctly.
Right.
Oh. All right.
Beautiful.
Do you see that all right?
It's beautiful. Yes.
All right. So we are going to talk about breasts. So a little background. I was diagnosed with breast cancer in 2008 in December. I came home, broke the news to my cat, and posed for this fuzzy photograph. It's kind of in disbelief. I had had an issue for almost 2 years. And finally, on this day, I was and after 18 different needle sticks for biopsies had shown that I did not have breast cancer. I finally had a surgery, and in that surgery, they found 3 little specks of cancer. And so it actually was breast cancer. So having been searching since the end of 2006, in December of 2008, I finally got my diagnosis. So I have a smile on my face because it really was a relief. It's like, okay, now I can do something about this. So that whole experience really made me realize how little I knew about breasts, mine or anybody else's for that matter. And I asked questions. I asked the doctors, I asked the people in the office, because I'd had 4 different breast specialists that I'd gone to in my search to find out what was going on with my left breast. But I realized how little information was out there about keeping breasts healthy. So my journey, I went through different surgeries, chemo, and then more surgeries. So 14 in total. I had bilateral mastectomy, I had reconstruction, I'd had chemo, and then I had different complications. So lots more surgeries until I finally came out with what I have now. So I decided I had to try and help others avoid having to go through this experience. There had to be a way that people could learn more about their breast health. So let's talk about breasts. And how comfortable are you talking about breasts? So breasts are mammary glands, right? They're glandular structures which are derived from skin. I'm just going to shrink this out of my way for a moment. They consist of apocrine glands. So apocrine glands, you may know, are sweat glands, but these are specialized for the manufacture of colostrum. Functional tissue consisting of lobes, lobules, and ducts to produce and transport milk to the nipple. And they're richly supplied with blood vessels, lymphatic vessels, and nerves. So as you can see from this picture, there's a lot that goes on there. And you can see too that these, whoops, I'm sorry. I disappeared. Uh-oh. There. You can see that all of these lobes and lobules, all of this functional tissue lies on top of the pectoralis muscle. So the breast itself actually has no muscle. All of that is on top. And I apologize for whatever is happening right here. I'll try this. Then, so the true biological importance of women breasts is to ensure the continuation of our species. This breastfeeding mother depicted here is the original sacred image in many cultures around the world. Colostrum is the first fluid excreted from the breast and provided to a newborn. It contains antibodies to protect against disease and infection, and contains immune and growth factors to help activate the newborn's immune system and start healthy gut function by seeding a healthy gut microbiome. It is vital for a newborn's development. So breasts are a vital part of reproduction. They develop long before they're needed and stay long after they've served their purpose. Unlike other mammals, whose breasts appear and only temporarily are there during ovulation or nursing. So for whatever reason, somewhere in our evolution, that changed in us. Ours formed during puberty, not pregnancy, and they stay with us for the rest of our lives. The earliest sign of puberty in most girls is the development of breast buds, and these are nickel-sized bumps under the nipple. It's not unusual for breast growth to start on one side before the other, and it's also common for breast buds to be somewhat tender or sore. This really is the time when, as a mother, you need to let your children know how to start taking care of their breasts. So we'll get into that. But gynecomastia is an enlargement of breast tissue in males, most commonly caused by male estrogen levels that are too high or out of balance with testosterone levels. And breast development happens in stages. First is before birth, again at puberty, during childbearing years, and then at menopause, which is when most problems arise. So let's take a look at breasts. We all have them. No two are alike. They have many meanings and connotations, and they need attention just like any other part of the body. So as you can see in this picture, this infant at the top is only 2 weeks old and already has breasts. And then the man down on the bottom left has breasts. So everyone has breasts, but right now breasts are developing sooner and sooner in a person's development, and not really what we think of when we think about breasts and their development. There are a lot of abnormalities these days. So what exactly are they? Every structure in our body is composed of fascia. So I want you to think of fascia as being this sponge. So our breasts can resemble the sponge in the top left corner there. Nerves, blood vessels, lymphatic vessels travel through this network to keep our cells healthy. So if you think of it as a sponge with all the different holes, you can see where the blood vessels would go through it. And it's really important to keep this tissue hydrated to prevent congestion and compression, because as with the sponge there, if it gets dehydrated and gets tight and clamps down, can you imagine what that does to the vessels that are going through it? And so the photograph here depicts actual photograph of very enlarged fascia. That's what it actually looks like. And you can see in the bottom right, the blood vessel going through the fascia there. That's what it looks like in reality. It's so important to keep it hydrated so that all the vessels, the blood vessels, the lymphatic vessels, and the nerves going through that tissue can function optimally. So our lymphatic system is the most important factor in our body's health. It cleanses body of viruses, bacteria, cellular debris, and cancer cells. We all have cancer cells. Typically, our lymphatic system will keep them in check. The lymphatic system works in conjunction with the cardiovascular system to cleanse the interstitial fluid and return it to the heart. So lymphatic fluid is moved in 3 ways: by muscle contraction, breath, and manual manipulation. Most lymphatic vessels have one-way valves which propel lymph towards 2 main lymphatic ducts. You have the right lymphatic duct, which drains the right side of the head, right chest, and right arm. And then the thoracic duct, which is on the left side, drains the rest of the body. Any blockage in this system can lead to health issues, especially in the breast. And I just want you to think for a moment that if fluid is moved in 3 ways, muscle contraction, breath, and manual manipulation, and there is no muscle in the breast, how does lymphatic fluid go through the breast to cleanse the system, to cleanse the tissue, if there's no muscle pumping to do that work? Add to that the fact that most of us wear a bra, and that provides further restriction. So again, a further obstruction for that fluid to be able to move through that tissue and cleanse it. So the lymphatic system works like this. The blood flows from the heart into the arteries that feed capillaries and provide nutrients to our cells. Waste from the cells is excreted into the interstitial spaces, which is the area between the cells. And then lymphatic capillaries collect the waste and transport it to the lymph nodes, where it's cleaned and filtered, then returned to the venous system for transportation back to the heart. In the breast, lymphatic fluid drains from the surface area towards the area behind the breast, known as the retromammary space, via lymphatic capillaries. From the retromammary space, it flows to the axillary lymph nodes, so all those under the arm. Approximately 75% of breast lymph drains to the axillary area, and most of the remainder towards the internal mammary chain, so deeper into the breast. Small amounts drain into the abdomen and under the diaphragm and along the sternum. So if a woman has large pendulous breasts, the only way to ensure lymphatic drainage is manual manipulation. As you can see here, she's pulled her whole breast up so that the fluid that typically would be drained down towards the nipple and the areola in her breast can now move, as there is no muscle in the breast to move that fluid. The only way to keep that tissue healthy and ensure that that fluid is moving through is manual manipulation or breast massage. The extent of breast tissue is hard to define, but the approximate borders are up at the collarbone, underneath the breast tissue, so what's called the inframammary crease, right underneath the breast here, along the sternum, and then along where your shirt seam would be, which is actually the anterior edge of the latissimus dorsi muscle. So in actuality, layers of mammary tissue can reach far beyond these boundaries. Larger breasted women will actually have breast tissue further around the back, but this is a generalization of where breast tissue will be found. Perhaps gives you an idea that a mammogram is not always going to catch an issue that arises in breast tissue, because it doesn't catch all of it. So we also have what's called the tail of Spence, and not many people are aware of this extension of the upper outer quadrant. It extends all the way into the armpit, into the axilla. So it's named after the Scottish surgeon who first discovered it, and it may be palpable or visible right before your period or during lactation, sometimes mistaken for enlarged lymph nodes or a lipoma, which is a fat-filled cyst, really. And cording may be found in this area following breast surgery. And cording can be a really restrictive fascial band that develops after breast surgery. As you can see there, the breast is usually divided into quadrants for when we're doing diagnostics, when we're writing notes. That determines what area we may or may not have seen an issue. So our breasts go through a lot of changes, especially during pregnancy and lactation. In the first trimester, there's growth of new ducts and early formation of new lobules. Breasts enlarge, veins dilate, pigment darkens the areola, and the tissue feels heavier. In the second trimester, more lobule formation and glandular activity. Cells convert to secretory cells. Colostrum begins to appear. Cells increase in size, and there's an increase in connective tissue and fat. In the third trimester, there's an increase again in glandular cell number and development, and more production of colostrum. There's an increase in the volume of functional tissue, so the lobes, the lobules. Breast size continues to increase. There's an increase in blood flow, and the breasts feel heavy and achy. Then at birth, hormonal influences transform the epithelial cells into a fully secretory state. And then 1 to 5 days after birth, breasts enlarge substantially, producing first colostrum and then milk. So the thing to think about here is that we have a lot of cell growth going on at this time. And at some point, those cells will no longer be needed. So involution is the term used to describe changes in the breast which occur at the cessation of breastfeeding and in the period after childbearing years. Changes primarily occur between ages 35 and 60, and many conditions known as benign breast disease appear at this time. The connective and functional tissue is replaced by fat. Lobe structures are slowly replaced by dense collagen, which over time is again replaced by fat. Postmenopausal breasts are almost entirely comprised of fatty tissue. Involution of lobules can result in tiny microcysts, which are considered normal. Formation of dense nodular areas and development of macrocysts are also believed to be normal during this involution period. Most of this process is symptom-free. As the functional tissue is replaced by fat, it explains the pendulous posture of an older woman's breasts. They're all going south as we get older. So here are some common breast conditions, and the term ANDI means aberrations of normal development and involution, used for conditions which confer very small or no added cancer risk. So as you can see, I love this picture. A fibroadenoma, it's a benign solid tumor containing glandular and fibrous tissue. So it can be followed, you can check it, or it may need to be surgically excised. There's a lot of fibrocystic changes that occur, which can be quite painful. So if you have some of these cysts that don't resolve at this point, if they don't get reabsorbed into the body, then needle aspiration may be needed just to reduce the fluid, because it's fluid that always causes pain. So a lot of other pain in the breast, which people are always concerned about, a prominent rib. Sometimes people are just born that way. Their rib sticks up into the chest area. But as the breasts get heavy and put more pressure on that area, that can cause discomfort. Duct ectasia is when a duct in the breast will get blocked, and that can get infected. So that's often very uncomfortable, very painful. It causes a lot of fear. Women have fear around breast pain, clearly because of breast cancer. But duct ectasia can also cause the nipple to retract, so which can be a sign of breast cancer. So it is something to get checked out. An intramammary lymph node often can be felt, very palpable. People get worried that they have a lump. It is literally just a lymph node and nothing to worry about. A lipid cyst is just that, a fat-filled cyst. And sometimes those will resolve. Sometimes they need to get looked at. Sclerosing adenosis. These are all things that can appear during menopause. And sclerosing adenosis is something that causes concern because it's an area that has an irregular shape. And anytime there's an irregular shape, especially if it's hard, it's very worrisome. But it's literally just a proliferation of epithelial cells which form a cluster and can be very uncomfortable. So there's many things that happen. A hematoma, you can get little bruises, if you will, but blood-filled areas. An abscess is very painful, as I'm sure you know if you've ever had one on a tooth or on another part of your body. And again, the cysts are very common. So a lot of issues that can show up going through changes in the breast. None of them indicate cancer, but it's always a good idea to get them checked out. So here are the different things that can happen. So epithelial, oops, I beg your pardon, let me go back. The first one, also known as epithelial hyperplasia or painful nodularity, and that's also a condition of premenopausal breasts. The greatest occurrence is in the outer half of the breast, especially the upper outer quadrant. You remember that diagram? Usually bilateral, but greater on one side. Doesn't have clear edges, which is why it's a cause for concern. It's an irregular dense zone within a standard breast tissue arrangement. So as you're doing your daily breast check, you may come across something like this. It's going to be sensitive to palpation, more so in the second half of a menstrual cycle, but it's believed to be caused by a hormonal imbalance or a response to hormonal influences. Actually very common these days. So fibroadenoma is a condition of lobular overgrowth. The mass feels round, smooth, rubbery, firm, discrete, and is highly mobile relative to the adjacent tissue. It's surrounded by its own fibrous capsule. So calcification may occur and may be palpable as a hard section of the mass. Generally found in young women ages 16 to 30. If there's growth beyond 5 centimeters, it would be considered atypical and merit further exploration. Sclerosing adenosis is again enlargement of lobules via marked epithelial proliferation. So anytime you have something that feels like a poorly defined mass of firm tissue with a degree of hardness, it's going to cause concern. This one has superficial similarities to a carcinoma, and it must be carefully examined to rule out malignancy, but usually there's minimal risk of it becoming cancerous. Cysts, I'm sure everybody knows what a cyst is. There are microcysts and then macrocysts, all normal aspects of lobular involution. So as the lobules get reabsorbed into the body, cysts will occur. So they can fluctuate in fluid content and may completely resolve. Sometimes if you're doing breast massage, you may get a sharp pain where there's a cyst, and all that is that the cyst has ruptured and released the fluid into the surrounding tissue, and whenever you get fluid in the tissue, it's going to cause a pain. So that will quickly resolve. Ductectasia is, as I mentioned before, a blockage in the duct. Fibrosis can occur, causing that inward pull on the nipple, which may also be a sign of breast cancer, so you need to get it checked out. And then a hematoma caused by an injury or surgery feels like a hematoma anywhere else in the body. A lipid cyst usually follows trauma again, a well-defined fatty lump, and an abscess is usually secondary to mastitis. It may result from ductectasia, diabetes, surgery, trauma. There's many reasons to get an abscess. Usually firm and painful. Again, not an indication of breast cancer. And then silicone injections, if anybody's ever had those are not commonly used nowadays, but can cause considerable breast pain and concern. The intramammary lymph node feels like a cyst, usually found in the upper outer quadrant, and not a reason for concern. And we talked about a prominent rib. So more pain in the breast can be caused by mastitis. Lactational mastitis happens during breastfeeding, caused usually by a bacterial infection. It is concerning because inflammatory breast cancer can present this way, but here this is something, again, usually happens during breastfeeding, so not something to be overly concerned about. Non-lactational mastitis is usually a progression from ductectasia. Usually somehow an infection has got in through the nipple. So it can also be a complication of tuberculosis or typhoid fever. Anytime you have inflammation, it needs to be checked out, and especially when there's infection like this. It is so painful, but again, not breast cancer. An abscess frequently follows mastitis. You're going to take that one to the doctor too, just to be sure that everything's fine. But that one, if you're breastfeeding, you're going to stop breastfeeding with the affected breast, and typically the course of treatment for that is going to be antibiotics. So mastalgia is pain experienced in breast tissue, and there are two types, cyclical and non-cyclical. I'm not going to go too deeply into these slides just because of time, but breast pain can have causes that aren't due to underlying disease. So it could be from a tight-fitting bra, pregnancy, menstruation, breastfeeding, or exercise. And pain from the breast often refers to the armpit and the upper medial arm. Worrying, but usually musculoskeletal. So cyclical mastalgia, I'm sure we can all remember what that is. And then non-cyclical mastalgia. Frequently the cause is breast or nipple pain in breastfeeding mothers. But ductectasia in women over 40 is the most common cause. Could be scar tissue, could be from breast implants, myofascial trigger point, can actually also be referred from the viscera. So abdominal issues can cause breast pain. But then it may also be of psychosomatic origin, especially if there's a history of sexual trauma or abuse. Many different presentations for breast pain. So everyone does get worried. 1 in 8 women in the United States will be diagnosed with breast cancer this year, actually. 339,250 women and 2,710 men are expected to be diagnosed with breast cancer this year. That does works out at 1 in 8 women and 1 in, I think it's 833 men. Whereas last year it was over 1,000 men. So it's becoming much more prevalent in men too. Many people have a deep-seated fear about the possibility of breast cancer to the point where they will avoid touching their breasts or seeking medical consultation. But we all have irregularities in our breasts. 80 to 90% of breast lumps are benign, and the 5-year survival rate, if it does happen to be breast cancer, is increasing every year. So here's just a chart showing the survival rates. If you can catch it early, 99% success rate. But if you catch it later, that success rate goes down to 22, that survival rate, I should say. So survival rates mostly depend on the stage when the cancer is found, and early diagnosis is key to successful treatment and survival. So here's what I would like everyone to know, and that is your lemons. There is a fantastic app that you can put on your phone called Know Your Lemons. It shows you the 12 symptoms of the breasts and what to look for as you're doing your daily exam. It also tells you how to do a self-exam. I'm going to talk you through a daily lymphatic cleansing, but this one will talk you, the app will talk you through how to do a more in-depth breast monitoring. So you'll learn that milk globes feel like soft peas. These are normal. Lymph nodes feel like soft beans. These are also normal. But if you feel a lump that is hard and immovable like a lemon seed, then talk to a doctor about it. You don't know for sure what that is. And we've gone over some of the other presentations that it could be, but that's when you need to go check with your doctor. So mammography is a very important tool. If you look at this hand here, the largest circle shows lumps found by accident. The one with the thumb shows that that was found through regular self-exam. Smaller one was found with the first mammogram, and the smallest one was found with several mammograms because they had that baseline to compare to. The baseline is always important. So risk factors and prevention. If you think about, we were talking about pregnancy and lactation, things that prevent our periods from happening, right? Menstruation increases estrogen in the body. So the more periods you have, the more estrogen you're exposed to. Breastfeeding and pregnancy reduce the frequency of periods. The risk is lower for women who've had a baby before age 30 or 35. And that's because breast cells are copied rapidly during pregnancy. But the older the cells are, the greater the chance of mutation as they replicate. So I'm sure you've all seen in various breast cancer awareness things, the risk factors. The biggest risk factor for breast cancer is age. So please keep in mind that most clinical changes in your breasts are benign. Only 3 to 6% of cases are due to breast cancer. Breast cancer is induced by the accumulation of altered gene regulation. So besides genetic mutations, epigenetic mechanisms have an important role in breast cancer formation. Our environment, the food that we eat, what we put on and in our bodies, affects every cell in our body. Breast carcinogenesis is a multi-step process involving both genetic and epigenetic changes. But epigenetics is defined as reversible changes in gene expression, not accompanied by alteration in gene sequence. So basically, even if you have the gene for certain cancers, depending on the environment that gene is in, it may or may not express itself as something that is threatening. So breast massage. Breast massage helps to maintain shape of the breast and prevent sagging. It stimulates circulation and keeps breast tissue healthy. It can break up benign cysts. It's a good healing technique for aching breasts and a reliable means of flushing waste matter from the lymphatic system. It's a great way to get familiar with your breasts in order to detect any irregularities, and it feels great. So breast massage is important. So I would like to talk you through a quick self-breast massage, a little daily routine that you can do every day in the shower to promote healthier breast tissue. Are you up for it?
Definitely.
You're going to start with your hands up near your chest and your palms facing you. Can you see mine okay?
Yep.
All right. So if you shrug your shoulders, then these little hollows above your collarbone are going to become evident.
Yes.
So you want to put your fingers there and gently traction, which means pulling and stretch the skin downwards towards the collarbone 10 to 15 times or more if the area feels tight or dense. But this is a very light touch, just traction. Then you're going to put your left hand behind your head. And with your right hand, just grasp the area between your armpit and your collarbone. So it's going to be right on your pec muscle. And gently squeeze that muscle, again, 10 to 15 times or more if it's sore or congested. When you've done that 10 or 15 times, you'd switch and do it on the other side. And I want
And this can be done daily?
Daily. Do it like you brush your teeth every day. Do this every single day. I usually do it in the shower. Do it in the shower just as part of your daily routine. Then you're going to place your hands under your breasts and cup them in your hands. And you can do this one at a time or both together. Depends on the size of the breasts. push them upwards and inward towards the chest, angle towards the same side shoulder. So for my left side, I'm pushing it up and in, but towards this shoulder. And I'll do the same on the other side. And you're just going to repeat that a few times. Because as I mentioned before, if you have all in our breasts, the fluid flows towards the nipple, but we have no muscle in the breast. So there's no pump to get it back out of there. The only way to do it is manual manipulation. And if you're somebody that has large breasts and they're pendulous, unless you do, as the woman was demonstrating, unless you do pull that tissue up and push it in, there's no way for that fluid to get in and cleanse that tissue. So when you've done that, you're going to take your left breast in both hands and gently move it in all directions. So you're going to go north, south, east, and west. And what you can do as you do that is use a flat hand to palpate the tissue and vary the pressure as you stroke each area. So you might do one stroke pretty light and just get your fingers used to what's under it, and the next one a little firmer. And you want to make sure you move all the breast tissue. So if you remember, that breast tissue goes all the way up to your collarbone. So you can stroke down from the collarbone towards the nipple, and then again, all the way from underneath. And you might want to just put your fingers over the center of your breast as you pull all that up. So basically what you're doing here is you're moving it. You want to make sure you get all that breast tissue moving, and you want to palpate all of it. You just want to just gently feel it all. But the idea is to get the lymphatic fluid moving through the breast. Interestingly, in the breast, the lymphatic vessels do not have valves as they do, or one-way valves, I should say, as they do in most of the body. So you can move that fluid around quite simply, but it needs to pump and end up back in the duct that is up at the top above your collarbone, and it does that through the axilla and then the inframammary space. So when you've done all directions with that breast, you're going to pump it up again towards the shoulder. And then you're going to stroke it towards the axilla and then towards the collarbone again, just moving that fluid gently back up. Then you're going to do all that again on the other side. Move it in all directions.
So, Sally, what do you mean by, can you tell us again what a congested breast, what constitutes a congested breast?
Absolutely. So can you think about the sponge?
Yes.
Back in that picture. So I hope you're all doing this with me. I'm just going to finish up here and then I will go through that. And by stroking up towards the axilla and then the collarbone. And then finish with a gentle pump to both breasts. So as you're feeling the breast, if you feel an area that is thicker, if it feels thicker, that's like congestion. If the sponge has been tight, so I always think of it this way: if your diet consists of, let's say, or if you were to mix sugar and water together, what do you get?
Sugar and water?
Yeah, you kind of get a sticky
substance.
Right? And if you mix flour and water,
it's like pasty.
Yeah. And then oil and water.
It's thick, impenetrable almost.
But oil and water flows, doesn't it?
But it flows, yes.
And so when it's congested, think about water trying to move through sugar and water, or trying to move through flour and water. It doesn't. It's first of all, it's very stiff. Like that flour would have to dilute in order for it to be able to move. Does that make sense?
Yes, it does.
So in your tissue, it's the same thing. If there's an area where it's congested, where it's stuck, where that lymphatic fluid cannot go, then you need to work it, because as you move the tissue, it brings hydration to the tissue. So it opens up that sponge. It's kind of like putting it in water, so it can open up. And then that congestion clears and everything moves out. So congestion can be from diet, it can be from lack of movement, it can be caused by all kinds of things. But typically, whenever something is congested, it causes a blockage, and therefore it's very tender when you touch it. So as you work it and as you move it, it will become less sore. And if you keep doing it, then that soreness should dissipate and it'll be fine. So as you do this each day, notice areas that are sore and then see if that soreness goes away as you do it. If it doesn't, then really keep note of those areas. Keep doing it for a while. If it doesn't resolve, you'll know to go seek medical attention.
Okay, thank you.
Of course.
One of the things that Women of Global Change Las Vegas this October, we are collaborating with the National Breast Cancer Foundation. And we selected this organization because they are very keen on education and early detection, which is so important for all women. In your experience and expertise, what are 3 things that you feel that women really need to focus on with respect to our own breast health? If there were just 3 things that we need to do every day, aside from the massage is number 1.
Massage is number 1.
Yeah, maybe 2 other things that we really need to focus on and be consistent about.
Exercise would be another. So exercise, and if somebody like, oh gosh, a rebounder, if you have it, is perfect for lymphatic drainage, but not everybody can use one of those. A vibroplate, just exercise, something that gets that lymphatic system moving through the body. That put that sign up there, massage your breasts daily.
Yes, thank you.
and then honestly, drinking enough water, staying hydrated. That is vital. So half of your body weight in ounces each day, because the lymphatic fluid gets very sticky. And if you don't drink enough water, it cannot move through the vessels to do its work. So that is very important.
That's the one thing that I push in my practice as well.
Yeah.
The emphasis on drinking water and staying hydrated and drinking half your body weight in ounces.
Exactly.
It's one of those things that's that simple, but it's the simple things that, sometimes we neglect.
That's so true. And drinking water is something that you're always like, oh, I'll do it when I get time. I'll go get that. But instead of having it right with you all the time, because you have to stay hydrated. It's amazing what a difference, or how impeded, if you will, the function of your lymphatic system can be once you become dehydrated.
Yeah, wait, toast, cheers, you and me both.
It is.
It's in a mug, but it's water. And then I have another question that came in. In your experience and with your knowledge base, and you have a global knowledge base because I know that you travel and share your wisdom and your expertise with others. Do you think, and how can I phrase this? I'll just ask it. Do you think that enough attention is being paid to breast cancer research? Or maybe what are some things that we can do as women and men on the grassroots level to maybe push things forward? I don't know. It's just an open-ended question that's come through.
Yeah, and a tough one, because the thing is, breast cancer in and of itself, you kind of have to look at the whole body. I always think of your breasts are like the canary in the coal mine, right? That's the first place. But if you've got cancer here, the chances are the environment of your whole body is not optimally healthy. So really got to look at diet and nutrition, exercise level, and look at it. Really is the environment. What are we putting in our bodies? What can we avoid? Can we avoid processed foods? Can we avoid plastics? Can we avoid any of the precursors for estrogen production, because most of these cancers are excess estrogen. So what can we avoid? How can we live that really does minimize our exposure to estrogen and then to other chemicals that affect hormones, because that's what's going to help in the long term, I think.
Yeah. And getting back to Know Your Lemons, do we literally just go to knowyourlemons.org and then we can download the app?
You can download the app. Yes, please
Okay.
do. Please do. It's just fun to do. And it's a great organization to bring awareness to the need for self-exam, to the need to check those, and to the 12 signs of breast cancer. So important, because women really don't know what to look for.
Right.
You notice a change in the skin, you may not think, uh-oh, that's, but nothing hurts. It's just that the skin has changed. Peau d'orange is the name for that presentation. And that's a sign of a serious breast cancer. So you want to check that. If you get a bump, you get a lump, you get maybe an inverted nipple, maybe some crusting around the nipple. There's many signs of breast cancer that we may not really pay attention to or think might be breast cancer.
Right.
So, yeah, have a look at that. The 12 signs. It's good to know and it's good to share.
Yes.
Share your lemons.
Yes. And before we leave for this evening, do you have any words of wisdom? What is your wow that you would like to share with us this evening?
Oh my gosh. I don't know that I have a wow.
Your whole presentation has been wow. I literally had to mute my mic and my camera at certain points because I was sitting here, wow.
Oh, thanks. Because
breast
I was
is
thinking I was
so
going,
vast.
I'm sorry?
The breast itself is so vast and has literally so many different configurations, chambers, channels.
For me, my wow was just the complexity of this part of our anatomy. That literally was a wow. The changes it goes through, how it develops, how it changes. How does it do all that? It appears and then it turns to fat. It starts out as one kind of life being and changes to another, right? But the fact that whatever happens here is responsible for the continuation of our species. So we really need to learn how to take care of this part of our anatomy. I mean, I've had a client with breast cancer at 17 years of age. We need to really make people aware of what's happening and understand that this can happen at any age. For a child to be 2 years old and getting breasts, there's something wrong with the environment that it's in.
Absolutely.
The estrogen.
Yeah, absolutely. So I would just say before we leave each other this evening, well, first I would like to invite anyone who has not joined us live this evening. We will replay this presentation, this fireside chat, this Sunday, October 30th, inside of the Facebook group. So you have to join the Facebook group. If you're not a member already, it's free. And it is Women of Global Change Las Vegas, specific to our Las Vegas chapter. And I would offer up, who needs to see this? Who needs to know this knowledge? If you are a woman, if you have breasts, if you are premenopausal, perimenopausal, postmenopausal, if you've had breast augmentation, if you've had breast reduction, if you have breasts. And I would also like to say, because of the increase in incidence with men with breast cancer over these last 2 years, anyone with breasts needs to watch this. How about that?
It's fabulous. But yes, and then of course, if somebody's had breast surgery, breast cancer or whatever, then that's what we do at my office. There's a whole protocol for that gives people back their range of motion, which you mentioned at the beginning. And then how do you take care of that presentation? That's a whole other, it's another hour.
And I'm glad you mentioned that. So briefly, please tell us where therapy is located, And if we want to book an appointment, what do we need to do? Because we need to hear that right now.
So therapy's in Las Vegas. It's near the intersection of Tropicana and Rainbow. It's at 6819 West Tropicana Avenue, Suite 200. The zip there is 89103. And you would just call 702-202-1400. And usually Jib at the desk will be happy to take care of you.
Okay. And do you offer, aside from your specialty, which is breast massage, lymphatic drainage therapies, and so forth, what other types of massage or therapies do you offer?
Oh, goodness. So we offer what's called a therapy session, because basically it is all kinds of therapies combined, whatever you need. Because typically, if you've run a marathon, you need one kind of massage. If you've had surgery, you need a completely different type. If you need relaxation or energy work or craniosacral therapy, we offer all of that. But our main focus is on women who've had breast surgeries and reconstruction surgeries, and then the lymphatic drainage needed for that, because there's a lot of liposuction involved in breast reconstruction. So post liposuction is really what we're offering in post reconstruction.
Wonderful, wonderful.
Of course, healthy breast massage. Get a full body massage, but include the breast.
Wonderful.
Yeah.
I can exhale. Thank you, Sally, for joining us.
Thank you so much for having me here.
I mean, always. It's always such a pleasure to learn from you. And I learned so much. I thought I learned a lot last year from you when we were at the Caring Place, but this is just off the chain right now. So I really appreciate you providing your time and your expertise, as well as your experience and just your ray of hope that comes through your personality. Just thank you so much.
My pleasure. Thank you. And can we mention the Caring Place?
Yes, yes, definitely.
For anybody who's had any type of cancer, but especially for people who've had breast cancer, they can go there. It's on East Sunset Road, and they can get a free session of the breast work to help them recover. So I just would like them to be aware of that.
Yes, absolutely. The Caring Place is wonderful. It's a place of hope. It's beautifully appointed. It's serene. It's a wonderful place. If you are a survivor and thriver of cancer, but also a place for family to gather, it's a beautiful place. And thank you for introducing that to us last year.
Absolutely. Thank you. And thank you so much for this.
Oh, you're so welcome.
You're doing.
We'll see you in a few months.
I look forward to it.
Thank you so much. And everybody, thank you so much, Women of Global Change, whether you are here local with us in Las Vegas, or this is also going to be shared on the global platform. So members of our 23 chapters around the world will also have access to this very special presentation tonight. Again, I'm Dr. Monica Riley. I am the president of the Las Vegas chapter, Women of Global Change. Thank you for your presence. Thank you for your light. Keep hope alive, literally. And we will see you next month.